Dr. Keshni Ramnanan. I live in Milwaukee, Wisconsin. I practice internal medicine. I predominantly practice in skilled nursing facilities and act as medical director for several of these nursing facilities. So the impact of COVID-19 has hit the long-term care facilities, these skilled facilities, very hard. In Milwaukee, it is a hotspot in the state of Wisconsin. In the beginning, we didn't really have a lot of treatments. We didn't have many resources like PPE or testing. And the requirements or the recommendations were constantly changing. And the CDC was constantly changing their thoughts and their recommendations. So it was kind of confusing in the beginning of COVID-19. Some of our facilities were hit very hard. We did have a few patients that unfortunately passed from COVID-19. I think it's been hard for patients. It's been hard for their family members. It's been trialing time for the facility as well as the nursing staff. Healthcare professionals have always been part of a community, and COVID-19 has really changed how community is looked at in the midst of a skilled nursing facility. Nursing staff is used to hugging patients and spending time and holding their hands, and now it's been a very different kind of dynamic where you have to stay 6 feet away, you have to wear a lot of masks and gowns and PPE, and the elderly are not very familiar with who they're looking at, because all they see is the eyes, and they get very disoriented, they get very uncertain of what is going on, and they get very scared. And it's been a trialing time for patients, not just from an illness perspective, but from a psychiatric, a psychological, from a social perspective. It has been very challenging. As time has evolved, there's been an increase in testing, and we have learned a lot about how to cohort and how to help mitigate the spread of infection within skilled nursing facilities. And it has helped significantly with more information and more PPE and more testing. It's been challenging, without a doubt. It's been very challenging. It's been sad. Sometimes going in there and you see the struggles of the patients, the nurses, as they struggle with trying to keep the patients calm and trying to keep them oriented, and to some level keep them to a routine that is going to be helpful for them. Yeah, one of the challenges is we have challenges with patients is that they're very hard of hearing, and so they automatically want to come close to you, but you have a 6 feet you're supposed to stay from folks, and so now they want to come closer because they can't hear you, and they can't read your lips, because part of hearing for them is also reading lips because you're wearing a mask. And so it's been challenging with some of them. We do have folks that are deaf, and how they communicate is actually reading lips. And so now how do you communicate? You have to take off your mask, and now you put yourself at risk. And so now it's been challenging for some patients. Some of the patients, they do have shared rooms, and this has been very good for them from a social perspective. But they've been with these roommates for a very long time, and as with the COVID, sometimes the roommate may become positive and then the other one may be negative. So now you have to split their roommates and split them up. And so that's a little bit challenging for them now that they'll be moved to other rooms, new locations, have new roommates. That has been challenging because now they have to, at this age, learn somebody else and their habits and their little quirks. On top of that, they've been used to this person. It's kind of like their family. And now they're like, well, where is this person and what are they doing? Are they okay? And they keep asking. And because of HIPAA, you can't tell them that their roommate is okay or that they passed. You can't always tell them these things. And so it's been hard for them because there's some roommates that they click so well together and they look out for each other. So even though that one may be bedbound and the other one's very mobile, you'll see them kind of like checking up on each other. It's like, hey, this person doesn't look so good, and they'll come and tell us. And they themselves become this family, and then you break this family up just because of this infection. And so it's been hard for them. I think there are two areas that I'm kind of interested in, and specifically in COVID-19. many of our cases kind of spread within the facilities because of asymptomatic spreaders or asymptomatic carriers. And these folks, you can check a temperature today and they're fine. However, in 12 hours, they're going to have a fever, but the 24, 72 hours prior to them having a fever, they could have been spreading the disease. And that's been a little bit of a challenge of how to recognize COVID-19 before you even start spreading it, before you have symptoms when you're asymptomatic. And I don't know how effective just testing everybody every single week to see if you have it. I don't know how effective and how, from a cost perspective and from a logistics perspective, to be able to swab every single provider, every single resident, every single week, which some states are doing right now. I believe Wisconsin's recommending the skilled nursing facility every 2 weeks. Every provider, every healthcare provider, every nurse needs to swab every 2 weeks to see if they have COVID. And so it'll be very interesting to see if we can find a way to determine asymptomatic carriers. The other thing that I find is interesting is that a lot of research is done for hospital settings. It's sometimes done for outpatient world, but there's very little research in general. COVID, pre-COVID, there's very little research within skilled nursing facilities, and the impact of these viruses and these restrictions and regulations on these nursing homes, as well as the patients, because it does cause a lot of restrictions. So I don't know if you're aware, but skilled nursing facilities is highly regulated by the federal government, and it's even as highly regulated as NASA and nuclear warheads. It's that much regulations. And so some of those regulations have been good, and some of them have been very restrictive to actually protecting patients, even though it was meant for that. And it would be interesting to see how COVID-19 or infections and some of these restrictions in the nursing homes, what really actually is happening, and how we can actually really remove some of these restrictions so patients can actually feel like, no, I am at home, I can move about, I can do these things just like as if I was at home, and still keep them safe from an infection control perspective. And so like I said, I practice medicine in a skilled nursing facility, and most people think it's simple nursing homes. You have your grandmother that's there. I actually do go to several skilled nursing facilities that manage patients on ventilators. And this is a very different kind of dynamic. People don't think about these patients sometimes. So we do have patients on ventilators that are chronically on ventilators, whether it's all day or just at night, and they come off during the day. And these folks have been in and out of hospitals. And because they've been in and out of hospitals, they have been exposed to many multi-drug resistant organisms. And so they are actually required to be in isolation. A lot of them are, these ventilator patients are already in isolation. So pre-COVID, what we had to do was actually put mostly gowns and gloves to enter into these rooms to manage these patients. So what we've noticed is that the patients on the ventilator units, they were always wearing PPE. The staff was always wearing PPE to manage them. But then the rest of the patients, PPE is all brand new now, COVID. And what we actually noticed in some of our ventilator facilities is that the ventilator units were not as exposed to COVID as the other side of the other facility, the other non-ventilator units. One of the thoughts of why the ventilator units were so protected from COVID, because they had PPE versus the other places, is that these patients aren't as mobile. They're not moving around and touching things, interacting with people, while the other folks are very much mobile. They're sharing bathrooms as well. And so some of those things we never really thought of as from an infection perspective. And moving forward, it will be interesting to see what happens in these nursing homes. Is, do we wear PPE all the time for every single patient care? And this is just now the new standard, the new normal. So when it comes to PPE, we do have some shortages within Wisconsin, especially when this all started. So the facilities that had ventilators and these multi-drug resistant organisms, they were already getting some PPE, the typical the gloves, the gowns, which is very in shortage. The gowns and masks and all those things, they already had those things coming in on a regular basis. It's the other facilities that didn't really have that kind of stockpile, or they didn't really have a normal supply coming in. And so what we noticed is the facilities that had these things coming in had a better supply. The other thing that we noticed is that if you were part of some of these nursing homes are part of big corporations. And so if you were part of big corporations, they could kind of move things around from one facility to the next facility and kind of share resources. So the little smaller mom and pop nursing homes or the smaller facilities didn't really have as much resources. And because PPE was in such high demand, the people that actually got it were, when you had COVID in your facility, then you were able to get more access to things. And sometimes I was like too late, it was after the fact. And now it's kind of spread, and now you have to like backpedal and like, okay, now we're wearing PPE. And so it's been a challenge. The fire department, the local health department has been very helpful in Milwaukee area to help provide some PPE. There was an outbreak in one of the facilities in Milwaukee, and from my understanding, they were wearing garbage bags. And so there were the huge garbage bag looking things, and there were areas to punch in the holes for your hands. And yeah, it's sufficient, but however, I don't know if people recognize is that these plastic bags are very hot, and when you're lifting and moving and you're moving around constantly, it's very hot and it's uncomfortable, and it becomes a barrier for really good patient care. They just want to kind of, you just want to just take out the warm gowns. And so it's not necessarily, it's been challenging to get some decent gowns. I know it's been challenging when it comes to the N95s, because the N95s is not something in a nursing home that you get fit testing for. And so N95s, you have to get fit tested. People are not, it's hard to even get somebody who's competent to be able to do the fit testing. And so that's been a challenge. And so some people use the KN95s, or they use a surgical mask because that might be the only thing that they have. One thing I have been very pleased to see is that even though like in nursing homes, even like in hospitals, you compete a little bit between businesses, but nursing homes have always been short. They've always been low from a budget and economy perspective. And I've been seeing a lot of facilities, nursing facilities, really collaborating. They're like, oh, you have an outbreak. We don't have any. Why don't you take some of my PPE? And, when you get yours, that's fine, pay it back forward, pay it back to us later. And they've been very good about some of that. Even with the testing, I've seen them share some of the testing resources that they have. It's been great seeing some of this collaboration occurring among competitors. If wearing a mask is going to potentially protect you, your family, your loved ones, why not wear it? Because if later down the road in 6 months' time, you realize that some simple act of wearing a mask and protecting and washing your hands was something simple act like that could have protected you, your loved one, I think I don't say you'll have regrets, but there will be a lot of regrets. So in Wisconsin's very different. We have some cities and a big highway that connects the major roads, but everywhere else is very rural. And so the rural areas haven't been hit very well. Rural areas haven't been really hit very hard, and they don't see it. So a lot of people in the rural areas don't want to wear PPE. There's not a lot of COVID there, but at the same time, there's roads. People travel. People want to leave the big city, go into the country and spend a weekend. And there is spread. That's how it spread from the east side of the world to the west side of the world, the Western Hemisphere. It spread. And to think that something simple as just wearing a mask, keeping a distance, can actually protect you, limit the spread, and hopefully at some point in time be able to allow you to come in like a facility at some point in time to see your loved one. The faster we could do this and take care of it, the faster we can kind of get back to normal and have some kind of interactions together, physical interaction. I think one of the challenges in the midst of COVID is that people have been quarantined or isolated. And as the months have evolved, people are getting itchy. It's summer. everybody wants to get outside, everybody wants to have a barbecue, everybody wants to be with their family. And I totally get it. I would love to be around my family and having a nice grill out and just being able to hug my nieces and nephews and just play with the kids. And I think everybody is yearning for that social interaction. And I understand humans were made to be social, and this is something that we all yearn for. And as cities and states are opening up, they're trying to balance between what is from a public health perspective, what is appropriate, and what is from a psychological or social perspective, and what is needed by people. And of course, there's always the business aspect. And you need to find that balance. But I think one of the things that I look at and I think about is from a public health perspective, if you take 2 steps forward, but you have to take 10 steps back because you were too hasty, or you wanted to do something that you just wanted to do something, and you have to take so many steps back, I think it's much more detrimental for everybody. And so it's easier to do simple steps, takes 1 step and see how things go, take another step and not rush things. Because like I said earlier, is that COVID-19 is a very new virus. There's a lot of research out there that's going on. There's a lot of things that we just don't know. And I think taking steps, step by step, and walking very cautiously and adjusting to what we find as time goes by will be very helpful. So my concern with states opening up is that, yes, it's the United States and it's one country, but every state is so different. My parents live in South Florida. I mean, there's this huge outbreak. My parents still stay at home. They haven't been by anybody. They've been literally locked up in their house in South Florida, and they can't really leave because from a health perspective, it's not safe. However, in Wisconsin, it's not as prevalent, and especially in the rural areas. And so you can't always treat every single state and every single city the same, because there's different ways. And I think that's been somewhat of a challenge for a lot of health departments of how to kind of roll this out. But even though the US is one country, we have a lot of states, we have a lot of cities, and I think you have to take things in consideration for where the outbreaks are, where the high prevalence is. And there will be different rules for different states and different counties and different cities, and you have to take in consideration those things. We all want to jump in a car and drive through a particular area, and we want to go to the beach and we want to go to the lake house, and I get it. But at the same time, why do things that are going to why do things that can potentially cause harm for 30 minutes or 6 hours of fun? I don't think it's always worth it. I think there's other ways that we can kind of modify to kind of do things. And as we're rolling out, and as we're moving forward in this new world of COVID, so much online things are being done. So we've been doing like playing games, like some of our lady friends and stuff will get online and we'll have a game night, or we'll have a wine night, and we'll kind of hang out outside on the deck. We all, in our own houses and kind of, chit chat, and it's different. It's not always exactly what we want, but in the context of where we live and what's going on in the country and the world, these are the boundaries I think that we should kind of live with, sitting within the boundaries of the rules and regulations, because it will keep you safe. And COVID-19, as we move forward, can we coexist with it? Yeah. We had the influenza outbreak. Things change and evolve. We had more research. Things, there was the vaccinations. Things kind of came up. We learned about better hygiene. We learned about washing hands and what's the best way to do that. There were new things that came up about alcohol gels, things like that just kind of evolved. And I think the humans and the world is so innovative. More things will come up that will allow us to adapt and to be able to function better. But I do believe PPE, masks are in our future, and it's in our future for quite a while. Not weeks and months, probably years. So just so you're aware, so when it comes to internal medicine, it's considered the bottom of the totem pole. Everybody wants to be a surgeon, a cardiologist. Internal medicine, people like, oh, you're a medicine doctor? Okay. And then on top of that, so people want to work in a hospital setting. And that looks like glamorous, and nobody wants to work with the elderly. Nobody wants to work in a nursing home. It's icky. It's like, it's considered the bottom. And to be frankly honest, I mean, nursing homes, I was concerned about it to a certain extent. Like, what are people going to think? And actually, doctors have treated me badly. It's like, you work in a nursing home? Like, how could you do that? And it shocks me, because the thing that strikes me the most in the nursing home is that people are lonely and all they want is somebody to talk with. And they feel abandoned and like not considered or cared for. And the 2 minutes that you walk in a room and you spend with them and you say, hey, Mary, long time no see, how you going? You're doing okay? It's like, you look like you lost 5 years. It's like, what you doing? You look so young and you're vibrant. And you start to giggle, and it's like, hey, you know, is that your grandchild? And you talk with them about these things that I find they matter so much more sometimes in medicine than giving a pill and fixing this pneumonia or this COVID. And sometimes just that social interaction is the thing that really, that for me as a doc in this nursing home is the thing that gives me more satisfaction.